Hello and welcome back. This is Dr. Julia Kovalenko, licensed psychologist, and today I want to talk about pain because September is Pain Awareness Month and it's something that we know can really impact quality of life. So we'll talk about different types of pain, so there's acute and chronic, and then we'll also talk about how pain is processed in the brain. So acute pain is when we have some sort of clear injury. So think a broken leg, and that is sending a pain signal to your brain saying, hey, don't step on your leg, like that's bad. And it usually goes away once the injury heals. With chronic pain, it's something that happens when, regardless of whether there's an injury or not, the pain signal persists for 3 months or more when we wouldn't really expect it to. And again, sometimes this is after you have an acute injury, but the pain signals just don't go away and it becomes a chronic issue even after the broken bone or whatever heals. And sometimes for chronic pain, there isn't a clear cause. So if we're thinking about functional abdominal pain, there isn't really necessarily a clear cause that ever triggered it. And so the reason psychology is often pretty heavily involved with pain management is because all pain is processed in our brain. No matter what type of injury you have, it's always going to be processed in our brain. So if I stub my toe, it's not my toe yelling, ow, that hurt. It's really the toe sending a signal through the nerves all the way to my brain, and then my brain processes that signal. And that's why we know there are things that can make us turn up the dial of pain and then turn down the dial of pain. And of course, behavioral management strategies won't necessarily take away your pain, but they will improve quality of life and they'll improve kind of dealing with the pain to get through this period in your time.